Hi, I'm Lauren. I'm an occupational therapist here at Gateway. I've been working here for 7 years. One of the most common diagnoses we see here is stroke. So today I kind of wanted to tell you a little bit about stroke recovery and the role that occupational therapy plays in that in an inpatient rehabilitation setting. One of our main focuses as OTs here at Gateway is addressing self-care skills. So we work on things like bathing, dressing, grooming, and the patients may need to do those in a different way. We may need to adapt the environment or use compensatory strategy to complete the task so they can do it safely or independently, even though that may not be how they did it prior to their stroke. We also address upper extremity function, so repetitive activities with the weaker side of the body. Some patients we use electrical stimulation on to kind of stimulate those muscles and nerves so that they can be rewired and hopefully work a little better to use that upper extremity for everyday tasks that they were able to do prior to their stroke. Some patients have cognitive and visual deficits following a stroke, so we use tasks such as medication management and just general memory activities to kind of improve those deficits for the patients. We have something here called the BITS that kind of integrates cognitive, balance, and visual tasks to improve all that. We try to get the patient to pay attention to that side a little more, or use strategies to get them to kind of look farther that way if they might not always see the best on that side after the stroke. Finally, with some of our higher level stroke patients, we address tasks such as cooking, cleaning, and laundry that the patients may have to do once they return home. Their environment may once again be modified. A lot of patients are using an assistive device such as a walker or wheelchair when they get home, so we have to kind of teach them to safely reach into cabinets and appliances and transport items using a walker. We recommend things such as a walker tray to put on their walker so they're not trying to carry things and push their walker at the same time. Also carrying laundry and things like that we will address just so they can safely do it at home. We also try to incorporate the patient's leisure activities or activities that are meaningful to them into some of our treatments. I feel like that helps motivate them a lot and encourage them to kind of get back to the things they were able to do prior to their stroke. One of our main goals here at Gateway is to always get patients back to their previous home environment, and we have about an 80% success rate here. Once the patient is discharged from Gateway, we always recommend continued therapy in a home setting or outpatient setting, as stroke recovery can continue for years after the stroke occurs.